Hello friends, I'm Tanupriya. Welcome to my YouTube channel. Today let's discuss about the types of headaches. So let's begin the video. Before that, please subscribe, click on the bell icon so that you will never miss my latest videos. So let's see about the headaches now. Headaches are the common symptoms, but there are different types of headaches. It can be classified as three types. So now let's see about the primary headaches. Primary headaches of migraine, tension and cluster headaches. So when it comes to tension headache now, tension headache, it is most common type of headaches which commonly affects men and women equally. And the most common symptoms are, there are four common symptoms. It lasts 2 hours to days. It can occur bilaterally and it feels like tightening and it will be mild to moderate intensity. And headaches are not aggravated by physical action, such as walking or climbing stairs. And when it comes to another symptoms, like there is low pressure, due to low pressure and squeezing, sensation of forehead and temples, it feels like that. And there will be no nausea or vomiting, and you will not feel sensitivity to light and you will not feel sensitivity to noise. And let's see about the treatment now. When it comes to treatment, there are three medications, which is acetaminophen, that is Tylenol, and ibuprofen, and Excedrin. If these three medications doesn't work for you properly, then that is the time where you meet the physician. Now let's see the second type of headache, which is migraine headache, which usually affects children as well as adults. Before puberty, boys and girls are affected equally, but after puberty, women are the most common cause for this migraine headache. So it is caused by inflammation or irritation of the structures or systemic illness including infection or dehydration. These are the toxic headaches which causes migraine. Common migraine can be one time or more than one time in their lifetime. It can affect both of your heads or one side of your head, which causes nausea, vomiting, sensitivity to light, sound triggers. Some people feel like cloudy weathers and fatigue, lack of concentration. These migraine headaches differ from one person to other person. So there are different kinds of migraines like tingling, numbness or weakness. We cannot say which causes which one for each people. And people get easily agitated or irritated to this type of headache. Best way to treat this type of headache is anti-inflammatory medicines like naproxen. This usually works very well. This naproxen is in a liquid gel formulation that works better than a tablet. Using this medicine like caffeine and acetaminophen, which also helps you more, but naproxen is the best tablet which I recommend you. If your headaches are more than 2 times in a week, that is the best way where you wanted to meet a physician because it affects you more severely. So that's the time where you can meet a physician. It might affect your nervous system, or there might be a change in your pattern of headache, or it may irritate you more. So it's the best time to meet your physician. Now let's see third type of headache, which is cluster headache. There are two types like acute and chronic, which usually affects in human beings, but which usually affects men. 2/3 of men will experience this cluster headache, which is mainly chronic headache. It's a rare type of headaches which comes in late 20s, though women and children will also suffer, but men are the most common cause for this. So chronic will be like non-fluctuating pain, and it causes and it occurs in the retroorbital and spreads one half of your hemicranium part. There are episodes of cluster headaches which occurs about 8 to 10 weeks. But if there is a gap about 1 year and again it will start, that is a acute headache. If there is no gap and it occurs without the gap even after the treatment, that is called chronic headache. Persons will get easily agitated, irritated, and they start rubbing their heads, but there will be no nausea or vomiting. It will be a simple headache which comes at the night, usually at the night for the men. And best way for treating the acute type of headache is oxygen therapy. If it's like too rapid, then you can give verapamil, which is a prophylactic medication. For chronic type of headache, you can give lithium. That is the best medication. If it doesn't stop after using these medications also, then that is the time where you have to meet the physician. If you do like my video, please click on the like button, comment and share my video. If you still did not subscribe to my channel, please do it now. Click on the bell icon so that you will never miss my latest videos.